but they were absolutely necessary. The goal is clear: to slow the rate of transmission, to protect the NHS, and to save lives. Our instruction is simple: stay at home. People should only be leaving home for one of four reasons. First, shopping for basic necessities, for example, food, which must be as infrequent as possible. Second, exercising once a day, for example, a run, walk, or cycle, alone or with members of the same household. Third, for any medical need, or to provide care or to help a vulnerable person. And fourth, travelling to and from work, but only where it can't be done from home, and employers should be taking every possible step to make sure that remote working can happen. These four reasons are exceptions to the rule. Further guidance is available on the gov.uk website. And I want to be clear that where people absolutely cannot work from home, they can still go to work. Indeed, it's important that they do to keep the country running. Key workers, for example, in the NHS, social care, pharmacists, and the medicine supply chain, should go to work, unless, as we've said before, they're self-isolating because they or someone else in their household has symptoms. We'll be publishing guidance later today to explain the steps that employers must take to ensure that employees are safe, including making sure there is a 2-metre gap between workers wherever possible. In addition, all non-essential shops and community centres are closed as of today, and gatherings of more than 2 people in public must stop. These measures are not advice. They are rules and will be enforced, including by the police, with fines starting at £30 up to unlimited fines for non-compliance. Madam Deputy Speaker, I want to update the House on shielding, which was introduced yesterday, if I may. We're writing to up to 1.5 million of the most vulnerable people in the UK to advise them that they will need to shield themselves from the virus in the coming months. We'll provide targeted support for all those who need it so they have the food, supplies and medical care to make it through. Guided by the experts, we'll look at the evidence and continually review the effect of these measures. Madam Deputy Speaker, we are engaged in a great national effort to beat the virus. Everybody now has it in their power to save lives and protect the NHS. Home is now the front line. And in this national effort, working together, we can defeat this disease. Everyone has a part to play, and I commend this statement to the House.
Shadow Secretary of State Jonathan Ashworth.
Madam Deputy Speaker, can I thank the Secretary of State, as always, for advance sight of his statement. And as he knows, yesterday we called on the government to move to implementing the enforcement of social distancing measures. So the Prime Minister was quite right last night to call for people to stay at home. Can I put to him a few quick points? Madam Deputy Speaker, this virus thrives on inequalities. It is the most vulnerable without financial security who are especially at risk. Could I urge him to consider, therefore, abolishing prescription charges for the duration of this outbreak, or especially for those with conditions such as asthma? We are very mindful of the mental health implications of asking people to stay at home, and we're also deeply, deeply concerned about the potential for domestic violence to increase by asking people to stay at home. Can he tell us what support is available on those two fronts in particular? We also need clear and unambiguous advice around which workers can and can't go out. We would call for just key workers to be able to go to work, because we've seen, for example, Sports Direct insisting that their workers turn up today. We're hearing stories of warehouses insisting agency workers turn up, of construction sites not putting in place social distancing measures. This is putting workers at risk, and it's putting the lives of all of us at risk. We need clear enforcement. And if we are saying to people that they will be fined for leaving their house, why aren't we fining employers if they're insisting that their employees turn up to work when really their employees should be staying at home? My humble friend, the Shadow Chancellor, will be putting to the government more points about income protection in the debate later today. Can I quickly turn to PPE? I understand the efforts the government have made, but there are still NHS staff saying that they have not got access to adequate PPE. We have still got hospital chief executives expressing concern that they don't have access to FFP3 masks, are not getting the visors and the sanitisers that they need on time. And indeed, when they do get the masks, they are different masks from the previous set they had got, so they have to retrain the staff. I really urge the government to move heaven and earth now to get the PPE to the front line that our staff need. And also, we need PPE in social care. We are beginning to see outbreaks of COVID-19 in social care homes. What support is in place for the residents of such care homes, and when will we get the PPE into the social care sector that we need? Madam Deputy Speaker, enforced social distancing is welcome. We called for it, but it is in many ways a blunt tool without ramping up testing and contact tracing. That is how other countries like South Korea have managed to suppress this virus. We are still only testing around 5,000 a day. We don't have enough community testing. We still aren't testing enough NHS staff. And as the World Health Organization has instructed the world, test, test, test. Now, leaked emails today suggest the government on Sunday was asking research institutions to borrow their testing kits. We've called for that. We don't disagree with that. But it also said in those leaked emails that the Prime Minister said there are no machines available to buy. I think many of our constituents, indeed NHS staff, will be asking, why didn't we procure machines and kits sooner? And on intensive care capacity, there are reports today that the Excel Centre will be turned into a field hospital of 500 beds. There are reports today that staffing ratios for intensive care are being relaxed. We understand that, given the staffing demands that we're facing. But if we are setting up more field hospitals, can he tell us how will they be? What oversight will there be? And also that, of course, means that more of our specialist staff will be stretched further. We understand why, but can he just tell us what guidance will be in place? Can he update the House on how many intensive care beds are now open and how many more will be opened, how many ventilators we have and how many more will be purchased, how many beds with oxygen we have, and what the current ECMO capacity is? And could he quickly just update the House on an issue that has emerged overnight about access to abortion care because of some of the implications in the coronavirus bill? Can he assure the House that women who want access to abortion care will continue to be able to access that care? Our constituents are worried, our constituents are fearful. I hope the Secretary of State understands that when we put these questions to him, we are doing so because we want the national efforts to defeat this virus to succeed.
Chief State.
Thank you very much, Madam Deputy Speaker. I'll go through the answers to the questions that he reasonably asks. He asks about the most vulnerable. There is a programme of work underway to ensure that those who need support because they're staying at home, especially those who are victims of domestic violence, get that support. It's incredibly important. It's incredibly difficult work, that we are doing what we can in that space. He asks about prescription charges. Only around a fifth of people pay prescription charges, so those who are the least able to pay already get free prescriptions. He asks about Sports Direct. Sports shops are not essential retail, and therefore they will be closed. I've seen a little bit of the noise that's been going around today around Sports Direct in particular. I would just be absolutely clear that sports kit is not essential over the next 3 weeks, and so we will be closing Sports Direct along with other non-essential retail. He asked about fines for corporates as well as for individuals. Absolutely, those fines are available if that is necessary. He asked about protective equipment, quite right, because as we discussed yesterday, having the protective equipment for the staff on the front line, especially in the NHS and social care, but also in other frontline services, is very important. We are moving heaven and earth, as he asks, and the military involvement is ramping up the delivery of that equipment. And he asked specifically about social care, and I'm glad to say that the current plan is to have protective equipment to all social care settings by the end of this week. And then, of course, we'll have to keep further going. And we've put in place the hotline so that if you need PPE and you're getting it, call the hotline so that we know where the difficulties are in terms of getting it to the front line, and so we can respond to those calls, and so we can get it to you. So I feel that very, very strongly. He asked about testing. Of course, as we've discussed many times, we are ramping up testing as fast as we can, including buying millions of tests. And my team are currently buying these tests that we'll make available as quickly as possible. He asked about there being no machines ready to buy. I don't recognise that at all. I obviously haven't seen any leak, and I wouldn't want to comment on a leaked email, certainly not one that I haven't seen. It is true, absolutely, that we're bringing testing machines together to provide a more efficient testing system, and I'm very grateful to especially the universities who have had these testing machines and who have put them into the system. This is a national effort, and they're playing their part. But we're also buying the machines where we can. He asked about the question of staff ratios, which has been publicised this morning. It's absolutely true that we are having to change the standard staff ratios for delivery of certain types of procedure, including ventilation. The reason for this is that you can't easily train up somebody to be able to intubate a patient and put them on a ventilator. We are, of course, training those who we can train to the standards necessary, but this is an incredibly difficult task, and it is therefore safer to have the clinicians, the doctors who are trained to do it and experienced at doing it to more people, and having more support staff than under normal circumstances. This is absolutely necessary to be able to respond to the quantity, because the quantity of need, because this is one very specialist part of the NHS, part of medicine, that suddenly has got a much bigger demand than could ever have been envisaged outside of a pandemic scenario. And so I pay tribute to the staff who will be working much more intensively and who are putting their vital skills at the service of the nation in order to save lives. And I'm grateful for the work of all those involved who've worked with the Royal Colleges to make sure that we get these ratios right, so that we stretch the capabilities we have, but we stretch them as far as we safely can in the circumstances. Finally, he mentioned abortion. We have no proposals to change any abortion rules as part of the COVID-19 response.
Jeremy Hunt.
Thank you, Madam Deputy Speaker. Can I thank the Health Secretary for the superhuman efforts he's taken to resolve the issues around PPE in the last week, and I think the evidence is that we are in a much better situation now than we were a week ago. He won't mind if I follow up what the Shadow Health Secretary said about testing, because the concern is that we appear to be testing on a daily basis virtually no more people than over a week ago, when the commitment was to increase the daily amount of tests from 5,000 to 25,000 tests. And given that this is a vital part of the success of the suppression strategies in South Korea, Taiwan, Singapore, Hong Kong, can he give us an estimated date when we will get back to routine COVID-19 testing in the community of all suspected cases? Because even if that's 3-4 weeks away, a date means there's a plan. And without a date, people won't be confident that this really is the plan.
I heard, although I wasn't in the chamber, I heard the comments that my right honourable friend and the chair of the Health Select Committee made on this yesterday, and he's right to push on this issue. I'm not going to give him the date, such a date today, because we are in the middle of buying the tests that are needed, and especially the new tests that have just come on stream. I have been able to give him the update that we have now purchased millions of these tests, which are arriving in the next days and weeks, and I'll be in a position to give him a more concrete timetable and make sure he gets that as soon as we can make it public.
Owen Thompson.
Thank you, Madam Deputy Speaker. And can I begin by extending our continued thanks and gratitude to all those working around the clock to help keep all of us safe and to look after us and those who are certainly most vulnerable in our communities. I'd also like to extend a thanks to the millions of people who have already acted on the government's advice to stay at home. I don't think the importance of this can be stressed nearly enough, because this is what we all need to do to protect our friends, families and those vulnerable people in our communities. It is deeply unfortunate that some employers, such as Sports Direct, seem to be acting in an entirely irresponsible manner, and I do welcome the comments that the Secretary of State has made in relation to that. And looking to see what more we can do, can the Secretary of State outline when he expects that we'll be in a position that all frontline NHS staff will have the PPE that they need? We need to be supporting these people as much as we possibly can and doing everything we can, given the extent that they're putting themselves, the risks that they're putting themselves in front of. How many additional ventilators have we managed to procure since the Prime Minister put out the call to manufacturers? And I can ask if the government are planning to accept the EU offer to sharing central procurement of ventilators, testing kits and PPE. Madam Deputy Speaker, Scotland's got a number of qualified doctors and nurses who arrived in the country during the refugee crisis. Can I ask if you'll commit to talking to the Home Secretary to see if there's what possible actions could be taken to relax existing rules to allow these people who are qualified medical professionals to support the country that they've adopted as their home? And can I also ask, is he ensuring that the rapid and effective contact testing, in light of the outcome of the Keeling study published by his own government on the 20th of March, showing such action could reduce the number of people infected by each case from 3.11 to 0.21, which would be a significant step towards further and greater containment of this current outbreak? And finally, Madam Deputy Speaker, can I just stress to the Secretary of State to, I suppose, to press the urgency with other Cabinet members of finding that support for particularly those self-employed who are still waiting to find out what position they're going to find themselves in, because we know that the pressures that people become under when they don't have any financial backing and the potential impact that that could have on their health, which would put further pressure on the system.
Secretary of State.
Well, thank you, Madam Deputy Speaker. On the last point, of course, there was an urgent question on exactly this issue, and it really is a matter for the Treasury. On contact tracing, he's right that it is incredibly important, and one of the reasons that we've managed to be behind other European countries in the curve is because of the amount of contact tracing that we did. But at this stage in the virus, being able to have contact tracing of everybody in the way that you do when there's a very small number is not possible. But we are looking at how we can do that better with individuals being able to contact trace, including using technology. He asked about refugees. I don't know if he was in the chamber yesterday, but that was brought up, and I said then that I'll look into it and I'll get back as soon as I can. He asked about the number of ventilators. We started with around 5,000. We now have over 12,000 that we've bought, and we've also had the call to arms for manufacturing capability to be turned over to ventilators, and that's been very successful. And can I finally say, I strongly endorse and support the Scottish Government and the SNP's backing and the UK-wide approach to get the message out, first and foremost, to everybody, that the most important thing anybody can do is to stay at home.
David Davis.
Can I commend the Secretary of State for his heroic efforts in our defence so far? But ask him that, given the prescription on travel is now a legal prescription, not simply a recommendation, to give us some clarification on what's meant by the care exemption, and that this doesn't just apply to professional carers. At the moment, and since things like special schools have been closed in the last week, we've seen a great deal of support being given by one family to another to, for example, give respite care for special needs children. This is very important, and the people doing it are very often being very responsible about the self-isolation that they're already applying to their collective families. Will this continue to be possible, and will he enable it in the future?
Secretary of State.
I'll say three things in response to the questions from my right honourable friend. The first thing is, with respect to special schools, of course, one of the carve-outs to the closure of schools was to keep open schools for those who are vulnerable, including those with special educational needs. There is a power in the bill to be able to move from that position, but we do not propose to exercise that unless absolutely necessary. So the position is, if you want to send your child to a special school, then that is absolutely fine. That was one of the specific carve-outs. In the same way that if you're a key worker and you need to send your child to school and you can't look after them at home, then schools are available. He asked about care. I just want to make it absolutely clear that for people who are volunteering in the response to COVID-19, people who are caring even with unpaid and informal caring responsibilities, then it is okay to go and do that. And you should do that, but you should stay more than 2 meters away from others wherever possible. But this has to be a practical instruction, because of course we need to care for people. And I said in my opening statement that caring, that you can travel including allowing for caring, and I want to make clear that volunteering in the response to COVID-19 is a legitimate reason to travel. And for instance, the many volunteers in the NHS and the increasing numbers of those who've come forward, these volunteers are important. So although it isn't paid work, it nevertheless is work in the effort, the national effort to respond to COVID-19. The final point I'd like to make, Madam Deputy Speaker, is that the Minister for Mental Health and Prevention and Patient Safety is sitting next to me and close to me, and that's because she has recovered, and all the evidence is you can't catch this twice at least in quick succession, and so that's okay. So I welcome her back to her place.
Liz Twist.
Thank you, Madam Deputy Speaker. And just to follow on the volunteering theme, I know that the government has already made arrangements in the context of schools, given advice that volunteers may still go in for certain purposes. Can you now expand further for organisations such as Samaritans, who use volunteers to travel to call rooms? And can you make it clear that that is acceptable for volunteers to do that?
Yes, it is acceptable. It is right that volunteers who are volunteering in that sort of work, for instance, for the Samaritans, should travel to do that.
Mark Harper.
Thank you very much, Madam Deputy Speaker. The Secretary of State will know, following the Prime Minister's statement yesterday, that all tourism and leisure providers have closed, and I commend those in my own constituency that are closed ahead of that advice in order to protect people. One issue, though, that has arisen: those that take lots of deposits are obviously being pressed by our constituents to return that money, but that may put them in financial distress. But equally, our constituents will be needing that money back given the financial circumstance that they're in. I accept the Secretary of State may not have an answer for me now, but can he at least commit to take that away and see if an answer can be brought forth, perhaps with support from the Treasury?
Yes, I'll get him an answer from the Business Department.
Daniel Zeigler.
The Independent Food Aid Network oversee the work of many food banks, and I listened carefully to what the Secretary of State said about volunteering. They're worried about the closure of community centres and churches as well. Yeah. Could he reassure them the valuable work that they're doing and with their volunteers will be covered by the guidance he's been giving?
Well, we'll set out precisely on gov.uk the breadth of this guidance.
Stephen Hammond.
Thank you, Madam Deputy Speaker. Can I commend, like my right honourable colleagues, the superhuman efforts of the Secretary of State? On the subject of procurement, could I just say to him two things? One is he will know that the PHE change of guidelines has caused some concern. Can he make sure that they're clear to people? And on ventilators, one of the senior A&E consultants reminded me that they need blood gas machines alongside ventilators, and more of those as well.
Secretary of State.
Yes, both are important points that we've got in hand.
Sir Edward David.
Good to see the member for Mid-Beds back in her place, though I'm not sure if the Minister still needs to have 2 metres distance, Madam Deputy Speaker. Can I press the Secretary of State on personal protective equipment? I hear what he says. It's good that the military are being involved in the distribution, but can he tell the House, is there enough PPE available for all healthcare workers and social care workers? If not, what's happening with the manufacturing and the procurement from around the world? Because we are told there is some available from around the world.
Secretary of State.
Yes, we have a huge quantity that we hold ready for an eventuality like this. That was, in fact, enhanced in our no-deal preparations. But, of course, we're also using that up. So we're buying to make sure that those stocks are replenished.
Andrew Morrison.
I'm very reassured to hear that by the end of the week, care settings will all get PPE, which is not what the leader of my council was being told recently. I accept the Secretary of State's reassurance. It's really good news. Could he further reassure me that the PPE, when it arrives, will be to the right specification? In particular, FFP3 in terms of masks and respirator masks, not simply paper masks, which are next to useless.
Secretary of State.
On the 2 points, if there are specific concerns about the non-delivery of PPE to council settings, then I want to know about them through the hotline that we've set up, precisely to short circuit having to the problems like this having to be brought to my attention on the floor of the House and then me go and fix them. Let's fix it directly. And on the second point, it's got to be the right stuff according to the clinical guidelines.
Ruth Cadbury.
Thank you, Madam Deputy Speaker. We've been told that by the time COVID-19 peaks, 44,000 women will need access to early medical abortions. Women shouldn't have to leave their homes during lockdown to access basic health care. So will the Secretary of State commit to not oppose moves in the other place to enable individual healthcare practitioners to certify abortions and reinstate the regulations that were put up for a short while on the government website last night, so that we can have use of medical abortion medication and one practitioner being able to prescribe on the phone?
There are no proposals to change the abortion rules due to COVID-19.
Sir Graham Brady.
Care homes are now being asked by local authorities to contract for block bookings of beds, but at the moment they would bear the liability if something were to go wrong, if residents were to come to them with the infection. Can I urge my right honourable friend urgently to look at the question of whether an indemnity can be provided?
Secretary of State.
I will get back to my right honourable friend on this very, very important point. I'm grateful that he raised it with me privately earlier, and I'm sorry that I haven't been able to get a reply in the time.
Kevan Jones.
Could I thank the Secretary of State for his statement? Would he join with me in congratulating and commending Packed House, a charity in my constituency in Stanley, which is delivering meals to the elderly and food with some 90 volunteers. They contacted me this morning, though, concerned that the building they operate from may need some type of certificate to actually keep operating following the announcement yesterday. Could you just clarify what the position will be? Will they just be allowed to open, or will they have to apply for some type of letter to say they can operate?
So long as they're operating within the guidelines that the Prime Minister outlined in his address to the nation last night, that are set out in detail on the gov.uk website, then they are doing the right thing and they don't need any further certification.
Tim Lawton.
Madam Deputy Speaker, one of the glimmers of lights out of these troubling times are the amazing community volunteer projects that have sprung up in all our constituencies. And Secretary of State will be pleased to know that on Sunday we set up Shopital outside Worthing Hospital, and I spent several hours selling rice, spuds and, crucially, loo paper to over 100 ambulancemen, nurses and doctors. But shouldn't that sort of arrangement be happening anyway with the supermarkets and with the new scheme delivering food packets to make sure those NHS workers for whom going at 8 o'clock in the morning for that golden hour isn't appropriate, they can get on with their job much more easily?
Yes, I didn't know that my honourable friend was engaged in that sort of activity on a Sunday morning, but I'm delighted that he was, and making sure that we can get get hot meals to NHS staff who are working often many more shifts than gives them time to make a good meal. I think that's incredibly important. It's something we're working very hard on, but I'm really glad when it's happening spontaneously as well as trying to be sorted from the department.
Chris Elmore.
Deputy Speaker. Can I thank the Secretary of State for his statement? I'm being inundated, as I'm sure many other members are, in relation to small firms that are still insisting on their staff going to undertake their roles, including on window and doors fitting, and other small firms are saying, well, the business is coming in, we're going to stay open, we're going to carry on making you work, despite the fact they're having to travel from different house to house to offer what is fundamentally a non-essential service. Can I ask the Secretary of State to raise this issue with the Bays Department and with other ministers to make sure these small firms that actually don't need to be working, arguably, should be keeping their staff at home?
Secretary of State.
I will raise that question and make sure that the appropriate guidance is put on gov.uk.
Kevin Hollinrake.
Madam Deputy Speaker, he's doing an excellent job and he's incredibly responsive despite what must be a huge volume of correspondence coming into his inbox, which I appreciate. He's damned if he is, if he does, and he's damned if he doesn't, but there is a confusion about whether you should be going to work or not. Can I say, from both a health perspective and an economic perspective, as a business owner, I would much rather have a short, sharp shock, which everything is closed down for 30 days to get this disease under control and allow him to get his testing and tracking in place so we can defeat this disease.
Secretary of State.
I agree with what my honourable friend has said. Not just the first bit, but I just repeat what I said in my statement. I want to be clear that where people absolutely cannot work from home, they can still go to work. Indeed, it's important that they do to keep the country running.
Patrick Grady.
Madam Deputy Speaker, but I think that's the nub of the confusion, because I'm hearing reports from constituents and elsewhere in the city that, for example, workers in call centres for outbound sales calls, which will undoubtedly be disruptive to people who are self-isolating at home if they receive them, are being asked to come in and work in cramped conditions that we know exist in places like that. Should these employers not be taking advantage of the government's furlough scheme so that their employees do not have to come into work? And is it not the case that no employee should be punished for doing the right thing and following the government advice to stay at home?
State.
Well, that sort of activity can technically, in a technical way, can be done from home, and workers where work can't be done from home, the employers should be following the guidelines to keep people more than 2 metres apart.
Desmond Swain.
There are many essential jobs and repairs that need to be done in people's homes by workmen. Surely, so long as those homes are not specifically shielded or self-isolating because of suspected disease, and that proper social separation is maintained, those ought to proceed, oughtn't they?
Secretary of State.
If they are essential, then yes, but the aim here is to try to absolutely push down on the speed of transmission of this disease over a period of the next few weeks to get a grip on its spread, and that means that everybody should consider that whilst we've set out the 4 reasons where it is reasonable to leave your home, people should stay at home if they don't have a good reason.
Streeting.
Thank you, Madam Deputy Speaker. I won't read the text message I've received from the member for Birmingham Yardley because it contains unparliamentary language. But further to the reply given to my honourable friend, the member for Brentford and Isleworth, I think the Secretary of State needs to give a clear explanation to the House as why it was yesterday that clear guidance was provided by the government on access to abortion early in the day, only to then be removed from the government website later in the day. Why is that? Why is the government not listening to the Royal Colleges? And why is the government making it more difficult for women to get access to an essential procedure during this time of crisis?
All I can do is repeat the clarity that there are no proposals to change abortion law.
Alicia Kearns.
Can my right honourable friend confirm what the advice is in terms of visiting loved ones in hospital? And can he confirm that Rutland is not a hospital desert, as reported by Sky News, as that has concerned my residents who have access to Leicester and Peterborough, and urged the media to be cautious about deeply unhelpful and sensationalist reporting?
State.
Yes, I think my honourable friend makes a very important point.
Shannon.
Deputy Speaker. Does the Minister not agree that the attempt to alter the abortion regimes through the coronavirus bill is not the right use of the statutory instrument, and that any change to such legislation and almost the last protection for our unborn children deserves adequate scrutiny and appropriate debate not possible right now? And will the Secretary of State, just for the record, assure me that no changes to this legislation, which regulates life and death, will be made in this way through stealth and opportunism?
I repeat the answer that I've given before, which is that there are no proposals to change the law around abortion.
Sorry to return to this going to work point, but the government last night was saying the only reason you may leave home to go to work brackets if you're a key worker, but then that changed in the brackets, but work from home if possible. I think this is the confusion, and people are not sure what they can and cannot do. And this is a pattern that we have sadly seen repeated and which has led to lockdown, not lockdown. Could the Secretary of State just say again, I'm not wishing to cause trouble, I'm just looking for clarity.
The Prime Minister was clear in his address to the nation. I've been clear in my statement today, and the guidance on gov.uk is absolutely clear on this point.
Kevin Brennan.
Thank you, Madam Deputy Speaker. Many honourable members are not here because they are being responsible and allowing some of us to represent them in order that we can keep proper social distancing. And my honourable friend, the member for Sheffield Heeley, has asked me to raise the issue of irresponsible employers because she tells me that the Home Office in Sheffield is requiring workers to come in to do work which could be done at home, work processing and administrative work which could be done at home. Will he undertake to communicate with the Home Secretary the concerns of my honourable friend, the member for Sheffield Heeley, and if that is the case, to put a stop to it straight away and set a good example?
Secretary of State.
I'll ensure that's looked into.
Tobias Ellwood.
Thank you, Madam Deputy Speaker. Would the Secretary of State join with me in paying tribute to the army of volunteers in Bournemouth and across the country, the individuals, the business people, the charity groups, the local organisations that want to be part of the solution in helping the elderly and the vulnerable, and indeed allowing us to adapt to this new way of life. He spoke, or yesterday was spoken about, the 30-day lockdown. This will require enforcement of some form. Can he say what role the armed forces might play in that?
The armed forces are doing an absolutely fantastic job in supporting civilian efforts, for instance, in the NHS on the logistics of delivery of protective equipment and much more. But the armed forces will not be involved in the enforcement of the law. That is for the police, and the police will levy the fines starting at £30 and escalating if people continue to flout the rules.
Bill Esterson.
One of my constituents is a home carer who has been unable to get PPE. She stopped working because her daughter has asthma, and obviously she's concerned about the potential for passing on the virus. I'm pleased with what the Health Secretary said about the availability of PPE, but people like my constituent need to know how to get hold of it. Their employers need to know how to get hold of it. I know he said it'll be on the gov.uk website. Not everybody knows about the website, so can he improve awareness of how people find out this information and make sure we have the access to the website and the phone number, please?
I will make sure that the honourable gentleman gets the phone number so that he can pass it on to his constituent, and so others in the same circumstance can know how to make it happen.
Ruth Edwards.
Thank you, Madam Deputy Speaker. NHS workers are on the front line of this battle at huge personal risk. Many have returned, especially to fight coronavirus. Does my right honourable friend agree that when this is over, we need to find an appropriate way to recognise and honour their bravery?
Yes, my honourable friend makes an incredibly important point, which is that we as a nation owe a debt of gratitude to those who work in the NHS, and we need to constantly search for ways to show it, and so that they all know how much we value the work that they do.
Matt Weston.
Thank you, Madam Deputy Speaker. I would like to echo the points made by the honourable member for Thirsk and Moulton about an absolute shutdown and absolute clarity to the public. But would the Secretary of State agree with me that we urgently need to get more FFP3 masks out there? That's what the frontline health workers are demanding because they're terrified by the prospect of this crisis. And that the masks that are provided to the construction industry would actually be suitable, so I understand, to be provided to healthcare workers.
Secretary of State.
I'll look into that point. They need to be clinically right, and so it's not for me to make that decision, but it's something that I'll take up with the Chief Medical Officer.
Richard Drax.
Madam Deputy Speaker, can I personally thank my right honourable friend for the rapid response he's given to every inquiry I've made on behalf of my constituents and for the department, and may I praise the NHS in Dorset and of course across the country for all the fantastic work that everyone is doing in the face of this appalling virus. We are still having problems, Secretary of State, getting PPE. I heard you say that the phone line you kindly referred to me is still the best way to try and follow up on that. And secondly, supermarkets are impossible to get hold of for food banks to go online to make regular deliveries. Is there some way we can get a message to all supermarkets to help out in that regard?
I'm grateful to my right honourable friend for the first point that he makes, and he's right that the hotline is the best way to sort out the PPE supply issues, and I'm told that it's already responded to over 2,000 inquiries and is moving fast through them and has a lot of people on the other end of the line to make sure you can get hold of somebody. And I'll take up the latter point with my right honourable friend, the Secretary of State for the Environment.
Peter Alders.
Thank you very much, Madam Deputy Speaker. I commend my right honourable friend for the sterling work that he is doing. Could he just provide some clarification on the definition of essential retail? The general store that purchases a freezer and says they're a food store quite clearly is not. But the garden centre, which incorporates a farm shop that may serve a local community, might well do so.
Secretary of State.
These things inevitably will end up being a judgment at the boundary. But what I'd say is that if you have two types of shop in one organisation, it is also we will be requiring some parts of it sometimes to close. So if you had a cafe in a shop where the shop sells essential supplies, the cafe must close, but the essential supplies can stay open.
Jason McCartney.
Thank you, Madam Deputy Speaker. Can I also, too, praise the Secretary of State and his wonderful team for their heroic efforts in fighting this killer virus? Can he just confirm that volunteers like those in the Home Valley COVID Mutual Aid Group, providing shopping service, delivering food parcels, picking up prescriptions, posting mail, dog walking, should continue to supply those services in a safe way for their community?
Yes, they should. They should stay 2 metres away from other people wherever possible. But the voluntary effort in support of COVID-19 is something we are actively encouraging and we actively support.
Aaron Bell.
Thank you, Madam Deputy Speaker. Obviously, I thank the Secretary of State for all he's doing. I also thank the thousands of retired nurses who've answered his call to come back to the NHS. If I could just raise a wrinkle, as in my constituency of Newcastle-under-Lyme, a nurse wrote to me, she's 58, she retired at 55, she's returned to work for 16 hours, is happy to work full-time, but is concerned about the possible effects on her pension. Will he and the Chancellor of the Exchequer work together to look at this situation to make sure there are no financial barriers to heroes like that coming back to work for our NHS?
Yes, we've solved several of the problems that were in the pension system at the budget, and there's further solutions in the bill. So I haven't come across any further problems with respect to pensions. If he writes me with the individual case, I'll check that that's the case in that instance too.
James Wilde.
Thank you, Madam Deputy Speaker. On Saturday, I met with the Chief Executive and the incident management team at the Queen Elizabeth Hospital in Kings Lynn in my constituency, where sadly 2 patients who tested positive for COVID-19 died last week. So can I pay tribute to the dedication of all the staff working in, as he knows, buildings that need more investment? And will he make sure that those on the front line continue to get the PPE that they need and also more access to ventilators?
Yes, absolutely, on all counts. And I just want to add my thanks to all those working on the front line and throughout the NHS and social care, to his thanks for those in Kings Lynn, and also put on the record my thanks to my extraordinary civil service, political and Public Health England team, who have done amazing work and continue to work incredibly hard in response to this crisis.
Scott Benton.
Thank you, Madam Deputy Speaker. Will my right honourable friend join me in paying tribute to our fantastic NHS staff at Blackpool Victoria Hospital? Some private firms in my constituency have offered free or discounted parking to NHS staff to help them out in these difficult times. Will he commend those firms and encourage others to do so to make sure that it's as easy as possible for staff to get to work?
Yes, I will. I want to pay tribute to all of the staff at Blackpool Hospital. I met some of them during the election campaign. I know that they're working incredibly hard in preparation for what is to come. And I absolutely commend all those who are giving free parking to NHS staff, and we're looking at what we can do to make that happy occurrence spread more broadly across the NHS.
Thank you. Presentation of Bill, Chancellor of the Exchequer.
Contingencies Fund Bill.
Second reading what day?
Today.
Today. We now come to the 10-minute rule motion. Caroline Lucas.
Thank you very much, Madam Deputy Speaker. I beg to move that leave be given to bring a bill to make provision for requiring public bodies to act in pursuit of the UK's environmental, social, economic and cultural well-being by meeting well-being objectives, publishing future generations' impact assessments, accounting for preventative spending and through public services contracts, to establish a Commissioner for Future Generations for the United Kingdom, to establish a joint parliamentary committee on future generations, to require companies to consider the impact of their activities on the UK's well-being and for connected purposes. It is a great honour to introduce the Wellbeing of Future Generations Bill today. I pay tribute to the bill's co-sponsors, to the indefatigable Lord Bird, and to everyone who's been involved in the Today for Tomorrow campaign so far. I wish that I was introducing this bill in very different circumstances, but I am confident that honourable members can see that the bill does not conflict with our immediate priorities, which are rightly elsewhere. Indeed, at times like this, it is only human to ask, what could we have done differently to prevent this from happening? How can we stop something like this from ever happening again? Our common interests, our connectivity to one another, and our compassion are all burning bright in an otherwise dark moment. Acting today for tomorrow is as relevant now as it will ever be. Now, as we wrote yesterday as co-sponsors of the bill in a letter published in The Guardian, it is essential to deal with coronavirus as it is, a global emergency. But it is clear that we must work harder to predict and prepare for the existential risks we face. Not only the threat of pandemics, but the climate crisis too. That is the nub of the Today for Tomorrow campaign. It's backed not just by all of the sponsors of this Wellbeing of Future Generations bill, but by over 70 MPs in total and many in the other place, who spoke eloquently in favour of its proposals. The Future Generations Bill is also gaining support from across civil society, from my constituents, and I'm sure among many others as well. And it all suggests that the desire to be better ancestors is incredibly strong. To me, it also suggests that we know in our hearts and in our heads that the way that we currently make policy and legislation does not adequately prioritise the well-being of our children and grandchildren. When we are rebuilding on the other side of this pandemic, we can choose to do so with greater consideration than ever to future generations, with stronger compassion for every person and their well-being, and with an unshakable commitment to building an economy and society that works for everyone, now and for the future. It is these values of compassion and consideration, cooperation and courage that hold us together in times of disaster. And these same values are at the heart of this bill, which it wants to centre in our politics at all times. Now, we're all aware of the pressures that regular election cycles place on decision makers to pursue policies that show benefits quickly, and that the difficulty that can add in addressing longer-term challenges. The climate crisis is an obvious example, with decades of delay between today's emissions and the full impacts of their heating. The glacial pace of climate action shows that economies and political systems the world over are failing to value future lives, and indeed the well-being of current generations in the manner they deserve. Last month, a landmark report from the World Health Organization, UNICEF and The Lancet found that no single country is sufficiently protecting children's health, their environment and their futures. That index, which compares performance on issues from child flourishing to greenhouse gas emissions and equity, find countries the world over are failing the next generation. We can and we must do better than this. And the same is true in other areas: poverty, regional inequality, environmental degradation, the overconsumption of finite resources. Each of these have their impacts today, but each of them also harms the health, the means, and the opportunities of tomorrow as well. Now, the concept of our obligations towards future generations is not a new one. It exists in every political tradition. It can transcend party politics. The Big Issues Today for Tomorrow campaign has secured pledges from the Prime Minister, the Leader of the Opposition, the former Leader of the Lib Dems, the First Minister of Scotland, and the Leader of Plaid Cymru. And I hope that the Prime Minister will therefore ensure that this bill continues its journey through the House in due course. The bill's co-sponsors represent all major UK political parties and every one of our 4 nations. Initiatives to put wellbeing at the heart of decision-making can be found in many countries around the world. New Zealand's wellbeing budget, led by the Treasury, invests billions in tackling deep-rooted social problems, including child poverty, mental health and family violence. Differing approaches can be found from Gibraltar to Ghana, from Malta to many other places. But it's actually closer to home that inspiration was found for this bill. The Wellbeing of Future Generations Wales Act was passed by the Senedd in 2015. Now, that act was pioneering, the first legislation in the world to enshrine in law a duty on public bodies to safeguard the well-being of future generations. It created a Commissioner for Future Generations, responsible for promoting sustainable development. That Commissioner, Sophie Howe, gives future generations the voice they currently lack. Her recent progress report shows that the legislation is making a real difference. Now, our bill similarly creates an independent Commissioner for the whole of the UK to represent those who cannot yet represent themselves. It empowers the Commissioner to bring legal proceedings against a public body that is failing to fulfil its wellbeing duties. It's important to say that the bill has carefully considered the Welsh experience and taken on the lessons learned, so it's even stronger legislation set out to be even more effective. For example, it strengthens the duty, ensuring that wellbeing objectives are actually met. And in addition to the independent UK Commissioner for Future Generations, I want to highlight a few of the other key provisions contained in the bill. A duty on the Secretary of State to publish national indicators that measure progress towards wellbeing goals and report annually to Parliament. A duty on all non-devolved public bodies to balance the needs of the present with the needs of the future. A requirement on companies of medium size and above to consider how their activities relate to the wellbeing of the UK. The establishment of a joint parliamentary committee for the future to scrutinise legislation for its effect on future generations, to hold ministers to account for short-term decision-making and to report on future trends. And a requirement on public bodies to report on and seek to increase their preventative expenditure. A study from Scotland illustrates this importance of preventative spending. It found that 40% of all public spending was devoted annually to alleviating social problems and tackling what is called failure demand, which means that demand, which could have been avoided had earlier preventative measures been put in place. I think it would be insightful if the government could provide an equivalent figure for England. Another study by the Joseph Rowntree Foundation found that poverty costs Britain £78 billion a year, with £1 in every £5 of government spending making up for the way that poverty damages people's lives. Madam Deputy Speaker, in conclusion, I am acutely aware that this bill is concerned with preventative spending and the next generation when there is an urgent crisis facing this one. Yet, as we have seen in the response of communities across the country, emergencies can bring out the best in us, can give us a common focus and a common purpose. The author, Rebecca Solnit, wrote that disasters give us a glimpse of who else we ourselves may be and what else our society could become. So with the eyes of future generations upon us, this bill presents Parliament with an opportunity to act today for tomorrow. Now, this bill is not a panacea, but it might just help us head in the right direction by enshrining long-term thinking and the voices of future generations at the heart of decision-making, precisely where they belong.
The question is that the honourable member have leave to bring in the bill. As many as are of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it, the ayes have it. Who will prepare and bring in the bill?
Bambos Charalambos, Simon Fell, Dr. Philippa Whitford, Vera Hobhouse, Liz Saville-Roberts, Claire Hanna, Abena Opong Asare, Bob Blackman, Anna McMorrin, Kevin Hollinrake, and Alex Sobel, and myself.
Caroline Lucas.
Well-being of future